I would say to my friend who came to me with this question would be to first explain what it means to be predisposed to a certain genetic disorder. Being predisposed to any genetic disorder means that you have an increased chance or likelihood of developing a disease based on the presence of one or more genetic variants based on their genetic makeup. Specifically, she's concerned about predisposition to type 2 diabetes. Type 2 diabetes, I would explain to her, has a stronger link to a family history and lineage than type 1 diabetes. Studies of twins have shown that genetics play a strong role in type 2 diabetes. Environmental factors and lifestyle factors play a huge role in it as well. If you have a family history of type 2 diabetes, it may be difficult to figure out whether it's genetic or lifestyle. It is possible to delay diabetes by lifestyle modifications like exercise and healthy eating habits, I would explain to her. I'd also explain that type 1 and type 2 have different causes. You, based on research, you inherit a predisposition to the disease but then something in your environment triggers it. In other words, you get that genetic inheritance for the diabetic disorder, but something in your environment like poor eating habits, poor exercising, just not making the best choices regarding your body can trigger you becoming a pre-diabetic and then a diabetic. Genes alone are not the cause of it. Just because you have a predisposition does not mean that you have it. In effort to tell her what to do, knowing this, I would talk to her and tell her, bring this information to your primary care provider because it's big information regarding your family history, and any family history should be noted to your primary care provider because knowing that family history can help prevent those diseases, take steps to prevent or delay that certain disorder. Even if you have a family history of diabetes, you can still prevent it. So I would just inform her to bring that information to a primary care provider and continue her lifestyle. She says she doesn't eat a lot of sugary foods, and that's good. And just encourage exercise